is key. And the human behavior characteristics, social distancing as we speak, hand washing, are really very vital. Yes, are very vital. So in case of numbers, as of yesterday, we had reported cumulatively 25,730 overall. And of note with the 219 deaths, representing a case fatality ratio of around 1%. But I need to put a caveat to this, that these are the reported deaths. There's possibility that we may be losing people who may not turn up in the facilities, because the very nature of the pathogen is that rapid progression, sometimes even the presentation is masked. It may not be the classical presentation that leads to death. And of note, these numbers that, as we see, nearly 90% have actually plumed between the last 3 months and the 6 months where we had almost only like around 3,000 cases. So again, as we see in the last 2-3 weeks, we're registering like 3,000 cases weekly. And on average, reported deaths in the facilities where we are managing patients, up to 14 on a weekly basis. But as I said, the numbers of deaths are actually likely to be higher than this, given the fact that we don't have systematic collection of information, more especially on mortality from the community. So this is where we are. But looking at the numbers, as I said, the numbers have swollen since August to date. And the biggest number of cases so far we've had really began rising in August, really in last month, November. And I must say that we have not yet reached a peak. And even the 25,000 or so that I've reported about could actually be a tip of iceberg, because we aren't able to pick each and every one. And the significance of this is that we really do have sustained transmission in various places. And one of them is the Kampala metropolitan, that is Kampala itself, Mukono, and Wakiso. But also in addition, we do have other hotspots. Now we are seeing another emerging hotspot in Kasese and Fort Hope, where we're having a large number of cases coming through. In terms of distribution of cases, principally, as I said, cumulatively, it is a disease between of young adults, 20 to 50, but the other age groups are not spared either, but that's where the biggest proportion is. And as you move, as we are currently seeing, moving into the much later age group or older age group, then there we are starting to see much more mortality coming over, and then seeing lots of deaths. So my colleague, I think later will speak about Kampala and the picture that we have in Kampala. But also additionally, this has not spared the health care worker. Close to 6% of the overall, remember the health workers, we are not many. So when I talk about 6%, if you weight it against the total number of health workers, you really see the burden really high. And I would like to say that we've lost up to 14 health workers of all categories, from specialists to nurses, and including community health workers. But this has not also spared the others. So then, just to speak a little bit about the drivers of transmission broadly, without going into specifics and details. As I said, that COVID being a hugely airborne disease, that means it's the transmission is fast, rapid, and most times effective. Most especially in situations where you have a big number of people congregated, and the few drivers that we see currently are mass gatherings of different sizes and of different nature. You recall at the beginning, we had a lockdown and a strict enforcement, and that was the containment phase, on gatherings, weddings, illegal bars, which are happening here and there, funerals, and some political activities that bring people together, congregate them, and then that has an effect of what we call super spreading. For example, you may only need one person to infect so many, and the so many that he has infected has a chance to infect so many, and then the picture really gets out of the way. So these are some of the issues that we need to think through, and even in the circumstances at an individual level, where we have to really, as I said at the beginning, to have, where I said at the beginning that we really have to watch over ourselves and make sure we consistently adhere to the SOPs. I would like to say this, that adhering to the SOPs, it's a narrow void. It should be, there's no in between. That today maybe I wore a mask, yesterday I will not. If you did miss getting infected today, the chances are clear that tomorrow you will actually get it. So you really have all the time to get it. And as I said, to give you a little bit of numbers on why we actually need to guard against getting infected, for the population to know that the clinical outcomes for the people who really get a severe illness is that the clinical outcomes are really bad. ICU survival rate in this country is really very low. And the very reason why one needs not to go there. So of all the patients that we've had in ICU, we've lost almost 66%.
66%?
Yes, so that means that the disease, when you get there, is really very difficult to us to really make sure we get you back. And of all the admitted patients that go through the HDU, or high dependence care, is that the case of investment and the cost of care and the pain of care is really a lot. And which again goes back to augment the fact that you'd rather not get there.
Okay.
You rather not get there. So I would like to maybe stop here. Thank you, sir.
Afande Doctor, if I could use that brief one, thank you very much. Dr. Daniel Okello, as you make your comments, I heard this in the United States, discouraging people, family gatherings as they were going into Thanksgiving. Now, many watching are making that decision on whether to go to the countryside, to their homes. Do you think, from a scientific point of view, somebody should go and see their mother, their grandmother, or should they stay where they are? And two, you could also speak to the idea of a nation known in dealing with pandemics. Are we in a place where we are saying, yes, we fought Ebola, this one too, we will fight, as you deal with your opening remarks? Thank you very much.
Thank you, Samson, for that. Let me start with the preamble. On the 1st of August, Kampala had 100 cases cumulatively. By today, when you look at KMP, we have 12,671 cases. So when you look at that, it tells you that in 4 months, our cases have actually increased 100 times. And when you talk about exponential growth, I usually give people the analogy. When you're making popcorn and you put it in a saucepan, you'll hear the first popcorn coming up. After that, the pops will be so many that you won't be able to keep up, but it just keeps on overflowing the saucepan. Now, with diffuse and exponential, that is where Kampala is. Now, you asked me, the question is that should people travel? And I'll give you another analogy. When you have a pond that is dirty, or a pool of dirty water, and a dog or a cat steps in it, and starts moving around, they will leave their dirty marks there. Now, when that is coming from the pond, wherever there is a mark that is seeding, you're leaving something behind that is actually a virus. And when you move, and let's give that example, now we are going to move, we want to move for Christmas. Why do we move for Christmas? We usually move to see Jaja, we move to see Kaka, we move to see Matt, and we know that those are the most vulnerable people. And as my colleague said, COVID does not have a color. You won't have a stamp on your forehead that I have COVID. You won't have a bell moving with you that you have COVID. So there is a high probability that you're going to infect the very susceptible person and the person you love dearly. That's why you go once a year to see that person. And everywhere studies have shown that each time there is that movement, within 2 weeks, you have this exponential growth. Now the health system is designed to mitigate, not to be able to manage a certain number of cases. Now, us in the public there, we are like where the cases are coming from. Now, for us to turn down that tap such that we can manage as a health system, people need to follow the basic SOPs. So most of the effects in the health system are external to it. Not that we are not doing a lot, we are absolutely doing the best. But if you do not put on the mask, if you do not avoid the crowds as we are saying, it is you who is not playing that part and making the health system suffer. Again, my colleague touched on something. The oxygen we breathe is free. And we have an opportunity to continue breathing it by putting on a mask and having these basic procedures. Once you go to ICU, the oxygen that was free becomes extremely expensive, both monetary, but even trying to get into your lungs by the nature of the disease. So why should I be able to go knowingly to such an expensive venture, yet I know this is actually free? Now, about the city, cities are characterized 3 things: crowding, movement, and activity. That's what makes a Chibuga. But because of that daily movement, COVID takes advantage of it. And when you look at these 3 things, what we are saying is, in crowds, especially certain crowds, you've been to a football match. I know Samson, you're a football supporter. And when the emotions that are there, if a goal is scored, you're not going to keep quiet, you're going to shout. Probably lower down your mask. Now, because you have no control of those emotions, it has been shown that when you shout, open your mouth, you actually release more of the droplets and you tend to infect more people. That is why in some of these crowds, we actually say would rather not have them in certain situations. That is where we are coming from. The second thing is, as I said, again, people may say, oh, how come people in Chikubo, how come people in Owino, why are we talking about the crowds of such nature that are emotionally, and we are leaving away people in Owino? Samson, when you go shopping and you're in Owino and Chikubo, you're moving quietly. Probably I'm rubbing your shoulder, I'm knocking into you, I'm putting on a mask, but I'm moving. When people start shouting and singing and doing that, you increase. Yes, Chikubo is also risky. Owino is also risky. But these other crowds have that we call the popcorn effect, the super spreading event where it will overflow. And again, the health system, we don't want to make sure our health system cannot be able to meet the needs. Because as health workers, we are trained to save life. And we are here to advise people how they can be able to preserve your life. So Samson, again, your last one. We have managed Ebola, we have managed Marburg. Are we capable of managing this? Yes, the best way to manage epidemics is when you can be able to work in tandem with the community. And that is what we are saying, how do we work with you? The principle of epidemic control, you can never treat yourself out of epidemic. You will never have enough medicine to treat everybody. But the basic preventive measures here are the ones that will be of help to us.
As somebody who works in the media, maybe as a doctor, you're being a little subtle. Would it be fair to say that if you like and love your grandmother, the best Christmas present is not to go and see her?
Perfectly said. If you love your close relatives, your grandmother, your mother, then that's the best Christmas present you give them. And a better Christmas present you give them is to make sure you're alive to receive the vaccine when it does actually arrive.
All right. I think from what I hear, once you go seeing your grandmother, especially from Kampala, then your grandmother should know that among those that love her, you are at the bottom of the list if you are there at all. Did I get that right, Sheila?
Yes, Samson, and I think those are very interesting statistics, but also the message from the doctors is worrying. So where people have let their guard down, I think this should be a wake-up call. And we'll get into the questions later on. We're going to take a short break, then we'll come back with the questions.
NBS happening now.
Enjoy great value from Airtel with the all-new My Pakalast combo offers. We have customized especially for you the best deals on minutes, data, and SMS with our 3-in-1 My Pakalast combo to give you the best value as you stay in touch with friends and family. To activate My Pakalast voice combo, dial *100*2*1# to get started.
Airtel, the smartphone network.
Please make those payments and take dinner out the freezer. Enjoy your day off.
Hey.
How was your day?
Great.
Did you pay the bills?
Abby did it.
And the plumber?
Abby did it.
Send money to your mom?
Abby did it.
Who's Abby?
Abby.
Bank on WhatsApp with Abby, your 24/7 digital personal banker. That's Africanacity. That's ABSA.
Did you take dinner out the freezer?
Parents and guardians, remember to take all your children below 1 year of age to the nearest health facility or outreach post for immunization services to protect them from killer diseases such as measles, rubella, polio, diphtheria, whooping cough, pneumonia, meningitis, rotavirus diarrhea, tetanus, hepatitis B, and tuberculosis. The 10-year-old girls will receive the HPV vaccine to protect them against cancer of the cervix. Vaccines used for immunization are safe, effective, and free, and have been approved by the Ministry of Health and World Health Organization. Remember to follow all the COVID-19 prevention measures, including wearing a mask properly, covering your mouth and nose when in public, hand washing with soap and water, and keeping a distance of at least 2 meters from another person. Vaccines work. Immunize all your children now. This message is brought to you by the Ministry of Health with support from UNICEF, World Health Organization, PATH, and partners.
Hello? Police! Enze kayibanda banange muje munyame ngude mubatemu. Bantu mudati banakede kantu. Ayo data we. Bakutemudde wa. Ibyo muwendo byange byona babituti nsawo yiri nkaruke beranze ntite kuyikwata ko bayinda konga baresemu bo.
Kayibanda sente nga mwezi.
Sente zona bali zitute nene bandekera mukama nayamba.
Buno kubuza polisi kwa nyini kati ntwala mugwe.
Data we nsonyiwe.
Kayibanda atakoze iki. Abuza polisi mubabye byokubene baleka sente. Tekisoboka.
Kayibanda katuni biliza mukama nayamba. Mukama nayamba bwe buramu bwange.
Ali wali atundira wali.
Yafani mugene mukwate omusajja wali.
Mukama nayamba drink alimu ekyama ate nga yatongozebwa ba UNBS.
When the world changed, it made us go back to the simple joys and love the little things even more, like serving up your best, eating together, and sharing more. Now, we'll take nothing for granted and always remember to taste the simple joys.
Enjoy the magic of Christmas with Coca-Cola. Geisha aloe vera and honey, made with the goodness of aloe vera to calm and refresh your skin.
Be strong and last long.
Where there's color, there's hope. It's Plascon Paint and Win, the Color of Hope edition. Buy Plascon Paint with 100,000 shillings, get a scratch card, SMS the code to 7197 and stand a chance to win 1 million shillings every day. Daily winners will get a chance to compete for a share of 5 million shillings more every Sunday at 6:55 p.m. on NBS TV. Terms and conditions apply. Paint and win with Plascon. Color your world.
It's a brand new day, yeah. Let your beauty show as your hair glows. With Radiant, everything comes to life when you arrive. And should you ever look back, let it be to gaze upon your radiant day. Rise up, African queen, fix your crown, yeah. Rise up, African queen, fix your crown, yeah. Radiant, look good, feel great.
With every second of every minute, every hour of every day, something is making the news around the globe. Unlike the old days, you don't have to wait anymore. Now, with NowPost, you get every story as it happens. Just log on to nowpost.co.ug or simply download our mobile app and catch all the breaking news in real time from anywhere. It's quick and easy to use. The NowPost, your accurate news fast.
Agent chako kokozesa yakawoowo nkozesa sunlight omupya ayeza bulungi engoye nazireka mwaka woowo ate nga wa bbeeyi nnungi. Try it.
Engoye zo zisenga sabbuuni w'obuwunga okuzigyamu obuwuka obuvaako endwadde. Sunlight atukuza ate era n'alongoosa. Weetabe mu kutangira okusaasaanya akawuka ka korona mu Uganda. Naaba engalo ng'okozesa sabbuuni oba kozesa sanitizer alimu ebirungo ebituufu yekka.
NBS happening now.
A very good evening and thank you so much for rejoining us, those of you watching NBS television and all other media houses, partners in this very noble responsibility of building a nation, especially now that we're going into an election. We are going through a deadly pandemic and we are certainly going through a festive seasons that bring persons and families together that normally bring crowds. But for those of you who are just joining us, where we left it off, Dr. Daniel Okello had given information and indeed advised that the best present we can give to relations, especially those that don't live in the city, is by not going to see them at all, because we are talking about what has been rightly defined as a popcorn effect. My name is Samson Kasumba with my colleague Sheila Tusime here, and it is this very special brief in which we have all the heads of agencies that manage security in this nation. I'm talking about the military and as well as the police and as well as those in charge of the docket of keeping an eye and ear open. They don't talk too often, that's what they've said. They normally listen and act on that information. We also do have the doctors, the front line in saving us from the pandemic, and information that we did receive is that you don't want to get into intensive care, because if you find yourself in intensive care, 66% of the time you won't make it. Yes, get that right. That is, if you get into ICU, your chances of getting out of there are 66% less than you thought. So don't get yourself into a situation in which you need oxygen that is not free, but very, 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 very expensive, Sheila.
Samson, before we went for the break, Dr. Monica Musenero joined us late, so she will be giving her opening remarks. But Doctor, as you give your opening remarks, would like to know, to tell the public the cost of treating COVID.
Thank you very much, Sheila. COVID a deceptive disease. And that's part of its danger. It's very dangerous because people out
Doc,
there...
you want to bring the mic a little closer to yourself? Fantastic. It's on, yes.
Okay. Yeah, so thank you. I was saying that COVID is a deceptive disease. And when it begins in the community, the cases are not visible. And the first people usually get infected in a community are young people, and sometimes they don't get sick. Then it runs in the community like a secret agent and spreads in the community. By the time people start getting sick, seriously sick, and start dying, the disease has spread. Now, the cost of treating COVID is very, very high. I have some people who have been to the treatment center. Some people have tried to go to the private facilities. And generally, if you go to a private facility, the minimum cost is 12 million. If you want to try. And that is usually, many people go there to the private facilities, and the main reason they abandon treatment there is cost. They abandon the cost there. But it is not just money. The cost of COVID, treating COVID, is very expensive. Because apart from the treatment that, they'll treat you now, you're COVID negative, actually your life is not going to go back to normal for the next 3 months. Many people, especially those who get seriously sick, they won't get to work for a long time. They will not be normal. Just because you are COVID-free, you've been discharged, it does not mean that you're normal. You are not able to work. Most people can't return to work for the next 6 weeks. The cost of COVID is a family disease. Once it enters a family, it will affect one member of the family after another. And so you have this one go in. If they get out or they die, as you move, you are spending on family members. Then, of course, you'll be under quarantine, so you cannot work, or under self-isolation, so the whole family will be grounded. Those are hidden costs of COVID that we do not see. It runs in the family. We have had families where you bury the head of family. After 3 weeks, the wife is dead, or grandmother, and then the others are in isolation. And because of that, COVID has very devastating effects, which seem to be hidden. We don't see them. So the cost of treating COVID, if you're just looking at money, that money component is small compared to the big cost. Then we have the cost to the nation. COVID works by overwhelming the health facilities. So it diverts care from everything else. Actually, right now, many patients fear going to the health facility because they think they are going to get COVID. So many people die from other things because they don't want to go to the hospital. But also, the number of cases which come, like now where we are going in Uganda, if we don't change the way we are behaving, it's going to reach a point where there is no bed to put you. Not because our health facility is weak, but because that's what COVID does. It overwhelms health facilities. We saw in Italy, we saw in Spain, in America, it will overwhelm the health facilities. And it deceives you when it is beginning, as if it is not going to be a serious disease. But as it grows and reaches an irreversible state of control, it overwhelms the health facilities. The worst thing is, it starts affecting your healthcare workers. The healthcare workers, especially the ones who are senior and they are able to look after people with such a severe disease, they get overwhelmed. They get sick and they start dying. Now, when the senior ones start dying, the others get depressed. They get discouraged. The few who are left overwork, and so the chances of getting infected become even more. They get burnout. And it is a long disease. Epidemics like Ebola tend to be short. We can deal with them very quickly. But this is a long-term disease. So you can imagine somebody working in that PPE month after month. So the health workers get burned out. And we don't have many who are experts to look after people that way so that we can just change and replace. So the best thing is for us to control COVID, control infections, and that responsibility largely lies with me, with you, with all of us individually.
Doctor, two things that I'd like to note. One, you talked about the healthcare system you said it gets to the point where the healthcare system is overwhelmed. Are we already overwhelmed, or we will get to being overwhelmed? And number two, we've had some young people saying, I'm a young person, I am fit, I jog, I play my football, COVID will never catch me. Speak to that as well.
Let me speak to the last one first. Unfortunately, that was at the beginning, that's what people believed. The young people felt, for me, I'm okay, even if I'm infected, I'll just jump off. We cannot predict. We cannot predict what is going to happen to you. It's true not everybody who gets COVID becomes very sick, but we cannot predict who is going to become very sick. We have had, I think the youngest death we have had is 19 years. Just came in quickly, felt very sick and gone. So you cannot say that, for me, let me get infected, I will be okay. Unfortunately, we can't tell that. Then we are at the tip. We are nearing the peak. And with the activities in December, with the activities, with the meetings that are going on, if we don't change something, January, February, March will be very, very deadly for us.
Thank you very much. COVID continues to bemuse us. I know a family in which she got COVID. They share the same bed. They share everything. And he doesn't have COVID. Maybe at some point we'll ask what research is saying to that end. We're now getting into the bit where we will ask the questions, but just before we get into those questions, we have been joined by the Commissioner General of Prisons, Dr. Johnson Byabashaiza. And this is about the time where we do play some information, some videos. Then they will make the bedrock of the question session in which we are getting. Take a watch.
The tone of this campaign is going to be set on Tuesday when we march from the tone of this campaign is going to be set on Tuesday when we march from Najana and Kumbi to go to Kiambogo for nomination.
You're going to march?
We are going to do that by defiance.
Nolwekyo embeera bwetyo bweri, mbeera si ya ssanyu, mbeera ya nnaku, ffenna tuli wano twasuze tutudde kubanga ne medical assistance ey'okubeera nga ebbowali ewabadde wova omusaayi omungi we twasembedde ejja okumanya tannaba kugifuna kubanga adde avaamu omusaayi mungi nnyo bagenza omuyingiza nga kavesiti katobye omusaayi bamufumise ekiso mu kiwato nga bamuyingiza akaduukulu nga bamuyingiza ako kannalufeenya ne bamufuuyira ebintu mu maaso n'agenda unconscious nga tamanyi biva biri ku nsi ng'olina kuzuukusa muzuukuse omugeti kino kyekiriwo naye nga talina kyategeera ate era saagala mbagambe tina kati tumanyi kyaliko munda mwali confirmed naye tetumanyi kubanga batya n'okumutulaga amawulire ge tufuna lwaki batya okumutulaga nti embeera gy'alimu tujja kugamba bannayuganda nti omusajja taasulewo taakeese kati bamututiisa omulaba bakyagezaako mbu okulaba nga balwana abe ng'atereratereramu then mbu bamutulage tebakkiriza muntu yenna amulaba lwaki because bamanyi embeera gy'alimu si ya mulembe ate batya omutwala mu ddwaliro ate batya kwegamba njovu gye baawambye tebalina bye basobola mussa
Didimala kyabbo amafoni banaye bateesa banange mwenna muve mu bintu by'okutunuulira amagye mutunuulire buli munyalwanda wasula mu Uganda yonna kyekyoka ekyo mulina okukola mu kuba be bawamba eggwanga mubasaleesale ku byalo kwe bali konna kati amagye gajja ennyumba ku nnyumba oba gasobola okumala ennyumba ku nnyumba mwe mubali nabo musula nabo mumanyi we basula mumanyi we banywera ekyo mukikole ng'obudde tebunnayita kuba tetugenda tuukana mu bululu kino kiragiddewo tetugenda tuuka mu bululu nga tebannata Bobi Wine mutandikire ku abo Banyarwanda abaliwo kuba si Bannayuganda ekyo bo bajja kuwamba ggwanga mukiwulira buli awula akatambi kanaakongereyo ono ayogedde amannya gange
Money.
If you don't have the mask, it is okay.
Well, those images are going to inform the conversation that we are going to have, and I've got to note that all those images are images of what has been happening in this country. None of those images has been picked out of the borders of the nation. Let me begin the questioning with AIGP Edward Ochom. We did invest very heavily in closed-circuit television cameras, CCTV footage. In dealing with security, we are going to need all eyes, human eyes, our phones, and those cameras literally everywhere. How far have we gone in making our cameras available?
Thank you very much, Samson.
You want to turn the mic right straight?
And the viewers.
Fantastic.
The cameras are there. We have had the first phase of the cameras, which actually targeted Kampala Metropolitan. And we are at 99%. We are able to view everywhere. And indeed, the cameras were the ones who helped us with, especially during that riot, as you have seen. Most of those clips were got from the cameras, and some of the rioters that were able to identify were actually because of those cameras. We are in the second phase of putting these cameras throughout the country, but we are looking at the cities, concentrating in the municipalities and towns, and also all the highways. And right as I'm talking, we are at 72%. And hopefully, by Feb or March, if it was not for COVID-19, probably by this time we would have completed phase 2 and maybe we would be thinking of phase 3. But that's where we are with the cameras.
Okay, Afando Chom would like to know, we have had claims by the opposition of selective treatment and brutality on them, and the opposition has also vowed that they will not work with the security agencies. Moving forward, what is the solution?
First of all, maybe not working with the security is not an option. It's just like saying I will not work with the doctors, because at one time you'll get sick and you'll get there. So for us, for those who follow the laws, there are quite a number of laws that have been put in place during this time of the electoral process. And our wish is that all the candidates, all the participants in this election should follow the laws as they are, which they should follow the regulations and follow the guidelines. And if they follow the guidelines, we do not have issues with anybody.
Afande, you have made your statement saying they need the police and the security agencies, which we agree. But they're also making their statement saying they will not work with the police. And I think that's why we end up with incidents like we have watched before on the news, on the different news channels.
No, what I was saying is there's no way you can avoid it. Because you travel on the road, you'll need the police actually to make it easy for you to pass through that very road. You will need, crimes will be committed against you, and even in your neighborhood, you will still need the police, and the police has to come in. So there is no way you can avoid it. The only way is for us to work together. And the best way for us to work together is actually for us to follow the laws that are there.
Okay, maybe CDF would want to add to that as well.
Yeah, thank you. That claim of selective treatment and brutality, I think, is misplaced. And I would want to say that it is the case that it is rather imposed on law enforcement by the consistent and deliberate choice of the accusers, the makers of that statement. So I'd rather we make a distinction between impunity and the claim of selective application of the law. We locate the cause of the problem and deal with it appropriately.
Let's come back to the issue of public order management. Is there a clear, transparent process of public order management that includes rules of engagement?
I would say yes.
Afande, your mic is not on.
I would say yes, because really, even specific to this election, we came up with guidelines. And one of them is this one here, Code of Conduct for Security Personnel. During the 2020-2021 general election, we have these guidelines, and we have given these guidelines to our officers. The guidelines are very detailed on what our officers are supposed to do and what they are not supposed to do. We have another guideline which we produced, and it is standard operating procedures on the use of force and firearms by the law enforcement officers during operations for 2020. It is also here. And it has a lot of do's and don'ts. And some of these are picked from international laws and other laws that are available. And we have given them to all our officers as a pocketbook, so they are supposed to read and internalize them.
Maybe as we wait for those to circulate around, for the public to know, when your officers come to the ground, what are some of the basic steps, processes that should happen? We've heard of using megaphones, warning, and then could you run us down those very briefly?
Sorry. We have the officers who are specifically trained in public order management. And those are the ones of FFU. And our first line is actually the FFU officers. The territorial officers come later. But even in that approach, assuming there is a demonstration, we first engage the demonstrators and we talk to them. And we talk to the organizers. Where the organizers agree with us, we don't have issues. Sometimes, and you have seen it quite a number of times, we tell them, please, don't take this route, take this route. And when we say that, we have a reason why we are saying, take this route, don't take this route. And if the organizers agree with us, we don't have any issues. And then after that, we warn them. And especially if now the situation is moving from a demonstration to a riot situation, then that's when we warn them. And the law allows somebody of and above the rank of assistant inspector to carry out a proclamation, which normally is read to the demonstrators when they are now turning rowdy and rioters. And they are advised that they should go. So the rioters, when they abide by that and they go, normally we don't have issues. But when they don't, then there are several other engagements that can follow. Because they are given time, even after the proclamation, they are given time to move to their lawful duties. And if they fail, they become rioters, they throw stones, they throw whatever, they begin fighting the security personnel. That's when they can be engaged either using tear gas or water cannon or rubber bullet or whatever. And all that is contained in this, and the officers know them very well.
I want to have a copy of those. General Muhoozi, when lives of Ugandans are lost, like unfortunately we saw and you noted in your opening comments, the conversation on rules of engagement, what they are and how they work, has filled this nation. Maybe there's something you want to supplement in that direction, in sort of trying to allay the fears.
Yes, my comment about that one is, in addition to what AIGP Ochom said, is these rules and the SOPs he talked about are eloquent about how to apply force, when and where, and are widely disseminated to the rank and file. But mention should be mainly about two things: how force is escalated. I think those are the guidelines, and then two, proportionality of which force to apply relative to threat. And these are the checklists to bring officers to account where there is non-compliance with the rules of engagement. The Inspector General of Police, before he left, said, we are going to investigate. And I think one of the checklists is going to be the rules of engagement and how they were applied in those particular riots that happened a couple of weeks ago.
About that, we would like to know, at what point do the sister security agencies come in? At what point do you come in to help police and the other agencies?
This depends on the information we get from intelligence. And there are two aspects, approaches to it, depending on the gravity of the situation as they read it, the people from Intel. You can decide to invest early, to deploy early, to avoid the constraints of loss of time, to avoid the constraints of logistics, so that you are in time to respond. Or you can decide to go the route of waiting for something to happen and then you wait for the call up from the police. So we chose, and I think informed by intelligence, that it is better to invest early in order to prevent rather than react, and sometimes react late. So that is where we are. And sometimes we also do a hybrid, call up later, but also with some element of preventive investment or deployment.
Thank you very much. Ambassador Ochoet, we've just heard the CDF talking about intelligence. The president has on several occasions talked about external forces with the intention of destabilizing the nation. And he's spoken about this for some time. What is being done to deal with those forces? I hope it doesn't fall within the category of classified information.
Thank you, Samson. It's true the president has always talked about external forces who are trying to interfere with the stability of Uganda. The president does this to alert such people or such groups to know that we are aware of their intentions, of their plans, and of some of the activities they are doing, which are negative in Uganda. But to most of us here, especially those who have been following the politics of Uganda over the years, including our foreign policy, I'm sure you know that we have very many friends who are foreign. We have very many friendly countries, many international organizations which are very friendly to us. And when you talk about countries, we have United States, we have United Kingdom, we have Europe. They are friends. We have China, we have Middle East, we have Egypt, South Africa, Russia. In other words, we have friends all over the world. But then there are a few pockets, I would call them, of enemies who are targeting for various reasons to destabilize the country. We know them. They are not a serious threat to us as security, but at the same time, we cannot just watch them and do nothing. We cannot ignore them. So when the president is talking, he's just alerting them that we are aware and we are following their negative activities. But in terms of threat, the threat level is very minimal. And as we all know, the external interference in Uganda started way back during the colonial times. If you remember from history, we have kings here like Kabalega of Bunyoro, Mwanga of Buganda, who had to go to exile as a result of external interference. Up to now, there are those who still try. Although at the moment they are mainly groups, I don't see countries which are trying to destabilize Uganda, unless one or two. But generally, even you, I'm sure you don't know of any country which is seriously trying to destabilize. But we know of groups, we know of individuals. Sometimes they raise money from abroad. They hold meetings. They write negative publications against Uganda. But to us, this is not a very serious cases. They are not serious cases. But then we deal with them, we manage them as they come, and the president, of course, refers to such cases. Okay. As you know, intelligence is about detecting a problem and preventing it. So when the president is talking, he's trying to prevent these people from going ahead with their what we would call ill motives against Uganda. But if they don't really stop, we have other ways of dealing with them. We have intelligence operations. We can deal with such people or such situations. We also have our political leaders who can manage some of those small threats. But there are cases where we use what I would call active methods to deal with them. These foreign elements who try to destabilize us, they always identify agents within Uganda, and these agents are usually politicians, and some of them are media personalities like you and others, among others. So we have methods which I would call active methods of dealing with this kind of foreign interference by, if necessary, arresting those who are collaborating with them, and then we take them through the due process of the law. So there are various ways we use to manage this situation, but I repeat, the threat level is very low. Okay. Otherwise, we have friends in the diaspora, we have many Ugandans in the diaspora. We appreciate the progress which is being registered in Uganda, the peace and stability which we are enjoying. But at the same time, there are other, even Ugandans in the diaspora, who are trying their best to cause problems here. So when we talk, we are talking about those negative groups, okay, but there are very few.
Ambassador, I hope you will clarify that when you used me as an example, you did not mean that I'm one of those being used. Somebody could cut that bite and I end up in the wrong places. I hope you clarify that. And then still as a follow-up question, you said that intelligence detects and prevents. The president has spoken about external forces funding political organizations here. Is that something that can be detected and prevented before it happens?
Yes, obviously. What I've said is that this group, the way they try to destabilize us is by raising funds. They collect funds and send it, but of course we detect it. What I'm trying to say is even the fund they are so far sending is not really a threat to us. I mean, we have organizations which can send $30,000 to a group here, sometimes even $2,000. We detect it, and sometimes we just keep on following. Because with intelligence, it's best to act at the right time. So we follow them. If it becomes a serious threat, that's when we take serious actions. But otherwise, we know it, we have the capacity to follow all those financial support which they are giving to various groups and to individuals.
On the matter I just raised on, it's got to be clear out there that I am not one on the line.
Yeah, I can make that clear, but we know there are media personalities who are negative. But I gave you just an example that media personalities like you or any other journalist or any other media person, but not you. If it was you, I would not have mentioned it here.
Thank you very much, Ambassador. We now go back to Afande Ochom. Would like to know, there are individuals out there that want to work with police and help police, but they are worried for their safety. Does police have a source or witness protection plan?
That is, it's not just that there are willing. We work with so many people. Actually, most of the successes that we have scored is because of the individuals. We may not have that capacity to move everywhere and get what is happening. But we have quite a number of people who give us a lot of information on some of the offenses, ranging from defilement, ranging from aggravated robberies, murders, and so on. People come and give us this information. And it is our duty to have them protected. We have a department of witness protection unit. But of course, we cannot disclose how we protect them. But for us, we know we are protecting them. And some of them we have protect them for quite a long time. Somebody has given information on a particular case. Sometimes it can go beyond. If it is a capital offense, for example, and it is going to take 3-4 years for it to be concluded, you may have to protect that person, sometimes even for life. Because when the person finishes serving sentence, he will still try to look for such a person. So we protect them. And we have a department specifically created to do that.
There was a security presser at State House, and the president noted that sometimes people are more comfortable in trying to go to him because they trust him and not the security agencies. To what extent has it been done to improve that?
The improvement is a process. But we also know that we may have some of our officers who may not be good at protecting. But sometimes you may also have those kind of witnesses who are themselves careless. You have given us information and you go out there and say, I'm the one who gave this information, maybe from a Marua port or somewhere. So that also puts them at a risk. But also we have to look at our judicial system. Our judicial system is such that sometimes you can provide that information, and the judicial system requires that you come and testify in court. And sometimes these are open courts, where now the person who provided information becomes a key witness, stands in the dock and faces the person whom he gave information against. So sometimes the judicial system is such that it may not be very easy. And some of them are very uncomfortable when they are being cross-examined. That gives reason why some may not even come to give a statement. Says, I've given you information and that is it. I'm not ready to come and give a statement and later on testify, because it doesn't want to be exposed. But we have improved a lot, and that's probably why the Commissioner General will say that his prison is actually full.
We will certainly get to the Commissioner General in a bit. For those of you watching, myself and Sheila are not wearing masks, but we've taken all necessary scientific SOPs to protect each other from the pandemic, and we're sitting within a safe distance from persons that we have found here. And moving over to you, Ambassador Chwet, there are some who feel that there is reactionism in dealing with the threats we pose. Some are saying security forces are only reacting. Is there anything wrong with intelligence being given? Or is it just a feeling?
Thank you once again, Samson. Some of the people who talk like that talk about situations, or what I would call cases. But as security, we are looking at the whole country. We are looking at our borders from north to south, west, east. And I can assure you that Uganda is very peaceful. We have security. We have peace, as I said. If we were reactionary, I don't think you would be enjoying what I'm talking about now. But of course, once in a while cases come up or situations arises. As I said, with intelligence, what is most important is timing. We time when to act. Most of these things we know, like even the plans to protest and to riot, but sometimes we do not know the exact time it's going to be triggered. Like the recent one on the 18th and 19th, we knew it, but what we didn't know was that one of the presidential candidates was going to break the law and be arrested on a particular day, and then his supporters or other people would react. So in that kind of case, yes, we can react, but otherwise we are very proactive. We know a lot. We do a lot, of course, together with our sister agencies, the UPDF, the police. The intelligence is very proactive, and that's what has resulted into peace, which is being enjoyed in Uganda for very many years. And we are going to continue enjoying it, despite some of these minor cases which come up, and we deal with them still through intelligence within the shortest time possible. But otherwise, we are very, very proactive. We know most of what happens, and that's why we are successful as the national security of Uganda.
Thank you very much. For those of you just joined us, it is a very special security brief here. We are going through an election as we are going through and fighting a pandemic. We are also going into the festive season and ending of the year. So we have the heads of the head of the military, the police, intelligence, and the doctors frontline COVID-19 pandemic fighting team. I'll hand over to my colleague Sheila.
Thank you, Samson. Now we'll be listening to the Commissioner General of Prisons. Would like to know how you are managing the COVID crisis in the prisons.
Thank you very much. First of all, we designated prisons to receive new entrants, having realized that definitely once we get people in, we are going to get COVID in. And we designated 59 prisons to be reception centers for people coming in during this pandemic. And it is in those prisons that we have had cases of COVID-19. And because we are congested, the COVID-19 disperses very, very quickly. You recall we started with the Amuru, with the over 300 cases, but then we have established what we call auxiliary treatment centers, because we cannot take these inmates into the National Health Service hospitals. We have one in Jinja, we have one in Guru, and we have another one in Moroto. And it is in these centers where we are treating COVID inmates. So far, we have had 933 cases of COVID in the Uganda Prison Service. And currently, we have only 25 active cases. The rest one have recovered. We have been lucky. I think God has been on our side that we have not had any ICU case or any high dependency unit case. So I think we are managing the COVID appropriately. There is one difference between the normal prisons and those auxiliary treatment centers, that we give better food, better nutrition. And to be exact, we add mukene into the beans, we give vegetables, I think that's what has been responsible for the almost, I would say, 90% performance on the cases of COVID we have had in the prisons.
Thank you.
Afande, the pandemic has brought a new sort of crime, that is the crime associated with the not keeping of SOPs. And we already knew that there were issues of space. How are you dealing with space vis-a-vis that new crime? And we are going through an election and arrests and all. How are you handling that? Is that side of things fine, or do you need help?
No, I will not ask you to give us a prison premises. But what we do, we made a prison like Italia. We removed the prisoners who were there into other prisons, and now it is ready to receive all new entrants. We had in the recent disturbances of riots, we have had about 578 people charged of riot-related offenses, and we have comfortably held them in the prisons we have. Definitely, we have congestion in the prison. If they bring you to prison,
God forbid.
God forbid. Unfortunately, I have a very bad tongue. You will meet congestion. You will meet congestion. But we also have methods which we use to manage congested situations.
Okay.
That is the current.
Okay. So far, I've survived your facilities by a whisker. Let's go to the Moroto prison break. How far are we in getting everybody who should be in back in?
Oh, that was a very bad incident in Moroto, which was unfortunately also related to COVID. When we took COVID tests in Moroto prison and we got a number of good positives, created a lot of anxiety among the prisoners and among the staff, and led to that terrible incident. And 224 inmates escaped. We have so far recaptured 46, including 12 who were put out of action. And they went with 14 rifles, and we have recovered 1 rifle. We are continuing to pick these people one by one. You recall that I didn't make a lot of noise in the media. It was deliberate not to make these people go underground. Like, for example, last week we picked 3 to make the number 46. So we are continuing to pick them. It's a matter of time. They have nowhere to go, and we know them, and we shall pick them as usual. That's how far the prison break has gone.
Thank you very much, Afande.
Would like to know the issue of repeat offenders. This is in regard to 18th and 19th of November and the people that were arrested. But also we want to know, has the prison's objective of retribution, reform, and deterrence failed?
Oh. Out of the 578 inmates whom we received, we found out that 29 of them had been to prison before. If you do some mathematics, what percentage is that? We know that we have 20% repeat offenders in our prisons. In other words, if I rehabilitate and reintegrate 100 prisoners, I expect 20% to come back to prison, 20 of them to come back to prison. That is a very good rate, by the way. In fact, it is the best rate in Africa, south of the Sahara. And it is number 4 in the whole world. So our rehabilitation is working. I want to give you an example. The repeat offending rate in the United Kingdom is 70%. The repeat offending rate in the United States of America is 65%. So you can see ours is working. Those 29, I just pray that the judicial system will convict them so that we can start on another rehabilitation. Our best rehabilitation, which brings less repeat offenders, is the formal education which we have in the prisons. We have found out that those who go through our formal education, from P1 to P7, from senior 1 to senior 4, then to post-secondary courses which are offered in the prisons, they never re-offend. And we shall continue in that direction, in addition to the life skills which we give to the inmates. And so I can say our rehabilitation and reintegration programs and processes are doing very, very well in the Uganda Prison Service. Thank you.
Thank you very much, Commissioner General. We now move to Dr. Chobe, who will be speaking in the capacity of a serving military officer, but also a medical practitioner. And in that capacity, we would like to know what kind of security threat is COVID-19?
Thank you so much. I would like, if you permit me, to go back to a question that you raised with Dr. Musenero earlier on the cost of treatment of COVID. First of all, there is no cost to life. I think that should be borne in mind. And the biggest mistake that you can make is to attach a cost to life. And the fact that it's a new disease, SARS-CoV-2, as we call it scientifically, is a new disease, and the long-term effects of which we don't know, and we may never know, for now. But to give you a glimpse that COVID has a propensity to attack the lungs, just like many other organs. But of course, the biggest culprit is the lung, where it causes extensive inflammatory process. That is the injury to the lung. And in patients that we see, or those who have recovered, in case you may have heard from them, the scarring or the fibrosis that arises out of the extensive lung involvement is really huge. And we don't know how far this will take us in the long run. So even when you may not end up in ICU and surviving, or in HDU and surviving, we need to think about this as one of the consequences that we need to look at. But of course, without going much details of what he said, but the cost is surely huge, more especially if you did you did actually look at younger people. As I said, it's predominantly disease of young people for the time, and now progressing to the older age group. That if you have sequelae in the lung at 40, at 30, and then you're going to live with this disability throughout your life. And we don't know to what extent or how soon some of these disabilities will resolve comprehensively so that you will return to normal, or if they will not, being a new disease. But now coming back to your question of COVID as a security issue. Security is about people's lives for prosperity and well-being, and that's what it is all about. Now, if you do have anything that destabilizes this, as a military officer, this is an issue of a security nature, more especially if it involves not only a single individual, but several individuals. And those, if I can use a Uganda word, we have to call Narumanya and Sarumanya, then it becomes even worse. So in that's why we take it as serious as possible to make sure that we protect those that are susceptible by guiding them on what they should do and what they shouldn't do, and to be able to protect themselves not to get infected. Thank you.
Maybe, and you'd understand this worry more than anybody else. Stuff is moving out there on social media that even when you hit out of COVID as a man, you may not go back as a married man the same way you went into COVID. Is there any studies that COVID affects potency? It could also serve double purpose to get men to wear their masks.
Yes, of course, as I said, the effects of COVID, given the fact that it attacks all parts of the body, there's likelihood that the effects span all the people's lives and different organs and different tissues. To the extent of that, I don't have the numbers, but as I said that those who have recovered and the obvious symptoms, but of course what you're talking about is not something that is easily investigated, given its nature. But what we know is that those who have recovered, the sequelae, the chest pain, the difficulty breathing, a guy was able to jog 10 kilometers, is unable to jog 5 kilometers, unable to jog for 2 kilometers as a result of recovery of COVID. So the issue is that whereas you may not end up on oxygen and having tubes all over you and pins and monitors making noise on you, and to be lucky to come out, the issues of your life in long term, in short term and long term actually we don't know because it's a new disease, but we are following up patients, are really grave. And that's what you would want us to really be able to protect ourselves from.
Thank you very much. Brothers watching, you've got it right there. Please wear your mask. If your husband is not wearing his mask as a wife, you have a very good reason to make sure he has it. Dr. Msenero, we were doing very well from March, April, May, June, July. Then we started the processes of our democracy. What went wrong? What could we have done better? And what can we still do much better?
Thank you. We were doing very well when we started because COVID, like other public health threats, is about how the people respond to the guidance we give them, because this is a disease which spreads from person to person. So when we started very well, we were moving together with the community. But as we went on and introduced tools, because you remember we started with lockdown. Now you can't have lockdown for too long. It will overcripple the economy. So the scientists were looking for which tools could help us to open up the economy. Now, at that time, we were counting on the people to adopt the tools, to put on their masks properly, to social distance. Now, when the political process came in, and it's unfortunate that not all leaders saw that this is a baseline. And this is not only national leaders, people aspiring for national leadership, but even at the local government and the MPs, not all leaders appreciated that for us as Ugandans, there needs to be a common bottom line, and that's the health of Ugandans. So as my colleague said, when politics comes in, it makes it emotional. And it makes it emotional. But it was not only politics, we also restarted a lot of meetings. And these meetings, like burials, became very regular. We opened church gatherings. People started having big weddings. And what the role of this has been is initially Kampala being what it is and what was happening in Chikubo, and the disease amplified here. I know we sat a lot, many times looking at this. So it amplified here. With the opening of public transport, a few cases started going out. But with the increase of these activities now, especially people who die and they take the bodies and the people who have been around that person go, the disease started to penetrate the country, the districts. And really, when you see the series of maps which have been produced, you see you can almost walk with the virus through the country. Now, around the time of the primaries, the disease was receding, having a few cases, and some districts were having transmission but undetected yet. Now, this intensification of activities, of campaigns, and sometimes because of the sensitivity of presidential level candidates, we are not seeing what is happening. There are tens of thousands of campaigners out there. They are all holding meetings. There are these community meetings from LC3. They are all holding meetings. And these meetings, what they are doing is they are amplifying wherever the virus was in one or two people. Now that one is infecting others. Now, when it initially started, because usually campaigns and the people who go are young people, but now these people are going home, and the virus is beginning to reach their elderly parents in the home. And that kind of amplification now reaches a stage where the disease spreads too fast, so fast. And so that's what has happened, that the disease has now penetrated. Kampala is still leading, but now we have rural districts that have high spread. The moment we have those activities which are causing people to meet, and some of them are super spreading activities like Dr. Okello described. These are activities where people sit for a long time or they meet for a long time, they are talking, they're excited. We have the popcorn effect. So those activities are now leading to amplification in the communities. What can we do? As a disease control person, I believe that at every stage, control measures can make a difference in the trajectory of the disease. And in Uganda, we still have a chance to stop this from further worsening. The beginning point now is, because Kampala is still very heavily infected. Now, as Dr. Okello described, if we have this massive movement of people out of the city into the villages, they are going to infect very vulnerable people. Because of our settlement system, our elderly, in the villages are still a bit relatively safe. But if we have these people going to stay for a week or two, then we are going to spread. So one of the things we can do is, please don't go to the village. Don't go home for Christmas. For Christmas, stay where you are. The second thing is, of course, we all need to take responsibility and stop the gatherings. Stop the big gatherings. when we started like opening up meetings, people were conscious. But now, because COVID at the beginning is really invisible, people have given up the SOPs. The weddings are massive. Let's cut back those numbers. If you have a wedding, cut it back, maximum 70 people with SOPs. Funerals should be cut, 70 people with SOPs. Churches, my leaders, church leaders, they should go back and rethink, because I know that they themselves may be knowing what is happening there. So especially during Christmas, when everybody goes to the village and then you all pour in the churches and then you all go to your mosque, and that is going to be bad. But we can still, just this Christmas, we will go back to our normal lives. And then I want to tell the Ugandans that hope is coming. The vaccines have now been discovered. We are working on our own vaccines here, but because we are still a bit behind, the vaccines are there now available in the world. But if you get infected now, you may not reach there. It is not like those days when we had no hope. Please stay alive and let the vaccine find you. Newer treatments are coming on board. Stay alive. And we need to guard this season of December, January, February. If we can pass that without having a disaster, then the vaccine is going to come and find us.
Thank you very much. Moving on to Dr. Okello. Dr. Msenero has mentioned that the COVID cases in Kampala are rising. What would you attribute this to? Could we say it's fatigue from the public?
That's, when you look at...
Dr. Pull that gadget closer to yourself. It is sanitized.
Yeah, science will tell you that it will take you about 60 days to develop a habit. And through developing a habit, there's what they will call dose and intensity. So when we give messages, and at times we want to continuously give the dose and intensity, such that we can be able to reinforce a certain habit, we expect that within a period of time, some people will pick it, and after a while, people will move ahead. So, yes, on one hand, you may talk about it being fatigue, but on the other hand, probably we may need to communicate more and more, such that people can feel that they are not doing it as a personal issue, but they are doing it to protect other people. Right now, the feeling outside there is that I'm putting on the mask for myself. But in order for you to beat COVID, you're only as protected as people around you are protecting themselves. And if that message could go down in that it is one for all and all for one. And that's what people in Kampala should realize. But the other thing is, COVID spreads through the social circles that we have. And the social circles in an urban center are both workplace-based and home-based. You spend 8 hours at work. You probably lower down your guard because this is somebody you've worked with for a period of time. And you're sitting with this person whose risk profile you do not know. When you go back home, you're doing the same thing. Lower down your guard. You do not know where that person has been, whether they have put on the mask all the time, whether they have done the basic prevention measures. So when you look at the profile in Kampala, we are having workplace-based cases. We are having cases where people have a history of having been in a social gathering. That is a wedding, that is a quandula. There are certain cultures where it is very difficult to avoid hugging. And because you've met somebody, you believe you'll hug. So with also the city being an area which by nature is crowded, all those are feeding into whether we are having a rise of cases.
Have we come to the place where we now want to wear masks at home? Or is that overstretching it?
From what we are seeing, whereby relatives are getting infected and they can point to having been with them in the same area, and as my colleague said, we need to put on a mask all the time, whether at home, whether in the car with your relatives, whether in office. That is how we are going to be able to beat COVID.
Did you seem to want to say something on that?
Yes.
You seem to be itching to add to that.
Yeah, for me as a soldier, you, for example, you only make one mistake and then the enemy takes you out. So the issue about wearing a mask, like I said at the beginning, is that you don't have to do it now and then you don't do it later. It's either do or you don't. Now coming to the family and or wearing masks at home, it is a consideration which we need to really think through, more especially understanding the family structure in this country, because a couple of us live with our grandfathers or mothers or our parents. And where in that group also you seem to have other comorbidities, hypertension, diabetes, cancer in many cases, as you see, non-communicable diseases are rising. You need to protect them. Okay. And then remember, like he said, that you have people with different risk profiles or exposure profiles, let me use that word. Because in a day, if you leave home, and I want to contextualize it at home, is that if you leave home, maybe your wife works elsewhere, you work elsewhere, maybe you have a guard or somebody. So all of you have various experiences, various exposures, and then you converge home. So to limit further transmission, and we've seen comms, and I would say this, that you may have one person exposed, but others spared. I think that's a good thing, and shows you how protected or protective it can be, the family. But still, we've seen the whole family entirely affected, including death. So again, it's an issue which the population needs to think through and work towards to make sure to protect others, or protect others within the home state. Thank you.
Thank you very much. General David Mohozi, we've had our experiences, and it took us quite a bunch to disarm the Karamojong. Now we hear presidential candidates suggesting rearming the Karamojong. You're the expert in this sector. Would that be classified as reckless political statements, giving our historical background?
If indeed that statement was made, then I think it's very unfortunate. Because the history of Karamoja before disarmament and now is very telling about the situation then and the situation now. And there is no amount of justification at all that would convince anyone that then was better than now. There's a lot of opportunities now in Karamoja thanks to disarmament. Whatever residual security issues there are, they can't be justification for going back to that time. But I would conclude by saying also that, assuming in the unlikely event that that statement is true, do you abdicate by privatizing security? Because security is a public good, and government is the main provider of that public good. So it's not there yet, and not at all. Lots of improvements in security. Issues of alternative livelihood, yes, but those ones can be dealt with in another way. One of which is this opening of access to Karamoja, hitherto embroiled in those issues of cattle rustling and all. By the way, there was a law at one time, and I still think it's on our statute books, of the presumption that if you find more than one Karamojong, I think it was 3, the presumption was that they are plotting to raid, which was very, very telling of the times. But it has changed drastically the situation for the better, and I think there's no justification for armament of private people to take care of their security, in this case, Karamoja.
General Muhoozi would like to know, following the 18th and 19th incidents in Kampala and other parts of the country, how do you restore hope to Ugandans?
I think we are hopeful. First of all, we were able, with limited effort, to come out of what happened, notwithstanding the cost, especially in human life. But 2, I think it is as well that it happened earlier than later, if only to up our ante for us in security, but also to inform the public that this is what bad people can do, and we need to collectively condemn them. And of course, for security, take preventive action. So it has buttressed our resolve to prepare better and more effectively, but also, like the Baganda say, it has also given early warning to the people that this is what bad people would want to do. And like they say in Uganda, ekijomanyi kinyaga bitono. So I don't think it will happen, but if it happened, it will be handled much, much better and at a lesser cost.
During the early days of fighting the pandemic, our good friends, those who were predominantly green, some of them were faulted for the actions. They went into refresher training. Are they good to go now? And hopefully handling a very difficult situation much better.
But before I go to the training aspect, I think we overly critique the LDUs, and we mask what they did well. Remember when they came, what was happening, and they contributed immensely to restoring security in Kampala. Never mind in the times of COVID, when they did lots of things, including food and relief distribution to our vulnerable people. But having said that, because of some gaps in what they were doing, the training we gave them has even made them better to contribute to security alongside the other agencies.
All energies and resources seem to be diverted to campaigns and the presidential candidates and managing the different situations across the country. Where does that leave the rest of the country in terms of security, especially as we head into the festive season?
I think that one is also a misnomer. We've had elections before. We're going to have another. We are going to have another election. This is not the first, nor is it the last time. And on top of the elections, we also have other enduring routine activities, including, if I may talk for defense, securing our borders and doing what we do on a routine basis. So it's not true that we are mainly now concentrating on elections, but also what we do as a matter of routine feeds into securing this national event exercise the election. So the two should be seen as complementary. And I want to assure Ugandans that your country is safe to the extent of the routine activities of security, be it in defense, be it in police work, be it in the prison services, be it in intelligence, the ones that give us early warning, like ably illustrated by the head of external security. So the country is secure whether we have an election or not. The way we balance our capacity is the detail of it, but we do it and we do it well without hurting one or the other.
Thank you very much. I'm sure our enemies were hoping that you would explain that balance, so they pick something you haven't, and which is quite interesting. Afando Chom, you are generally the lead when we get into matters elections. What's your comment on the threshold of expectations across players within the electoral process? We're talking candidates, the electorate, the EC, and ourselves, the media. What sort of policing are we likely to be seeing?
I think we have already done a lot. We are almost at the tail end of the election period. I remember we started with the registration of voters, and there are quite a number of processes that we have managed very well. We are now at the campaign period, which unfortunately, as you have seen, has not been handled very well by some candidates, because we are also in the midst of COVID-19. And that is where I really request you people in the fourth estate. When we had HIV/AIDS, the drumming and whatever, I really saw the media playing a huge role, and you really saved the lives of very many people by so doing. This one, you would rather capture somebody tear-gassed than somebody having mass rallies, demonstrations, and processions, which puts the lives of very many people at stake. I am surprised that the press is really probably not doing what the population is expecting of them. You really need to, because it is all of us, and it is touching on all of us. And I have said it once and many times. If it was AIDS, I would avoid after I have tested negative. This one, I don't know how many times I have tested myself, but even after here, maybe tomorrow again I may go back and test. I just have to continue testing. So I think we should rather concentrate, and people should not look at elections at the end in itself. We should look at the lives. Because you may not even live to see the results of that election if we continue being as reckless as we are. So mine is really a humble request to the media that we really need to drum the support that the medical profession are telling us. They have told us here, and we have all heard. I don't know what will be there, as Dr. Musenra has said, by March next year. We may not live to be there. So we really, my thinking is that we really need to look at this issue of COVID-19 seriously, much as there is election going on. What we have done so far, I know, is okay, and we have done well. Quite a number of processes. What is remaining is the campaigns. After campaigns, we shall have to go into the actual election, and there are also processes in between of providing security for the election itself, providing security for the tallying, and the results, and also managing the security after the election itself, which will take us probably up to the swearing in, and probably after the swearing in. So we still continue to provide security.
Thank you very much. Afande Muhoozi, is there anything you want to add to that?
Maybe I'll speak to the expectations from each of us in our society, and taking it from the submissions of colleagues this far, I think there's a minimum of expectations from each player in our country in the normal course of life, but also in particular in the current electoral period. And I'll start from the leaders. My appeal to the leaders, especially the voluntary participants in the electoral process seeking political office. Because our understanding as security is that the undertaking to participate was premised on the understanding that they would be bound by the rules and guidelines of the exercise. But however, what we've seen this far, and this has been demonstrated by the pictures you saw and the submissions of colleagues, are cases of consistent and blatant breach of the rules. And these have been mainly the causes of the contention between law enforcement, but also these participants in this process. So they have a role to play, a leading role actually, to play in ensuring that we avoid the risks talked about by the experts, our medical experts. The EC, its role is cut out. They are the principal organizers of the exercise. And we believe they'll do their role as expected. The electorate, the people, the population, those eligible to vote and those who may not be because of age or other reasons, our appeal that they must engage and conduct themselves within the law, the dictates of the law. They must ensure, first of all, it has been amplified by the previous speakers, that they stay alive and safe from the COVID perspective, in order even to vote, because I think it's selfish that if you want to express your vote, do not disenfranchise yourself by being reckless. Avoid all the things they talked about, the medical experts. You should also have a reason to exercise patience by staying safe through the hope that you will access the vaccine. Do not donate yourselves to COVID by breaching the SOPs, by engaging in unlawful conduct. Number two, don't be lured into crime. The right to enjoy your rights and freedoms is matched by duties and obligations, including not denying others the same rights and freedoms. Conduct yourself in ways that are not outside the law. If you do, this invites serious consequences. You'll be, of course, in clash with the law. Then the other players are us, security, law enforcement. It is our responsibility, like I said from the onset, to provide security to all, to ensure law and order without fear or favor, in order to stamp out what I think is now creeping impunity in our midst. It is also the responsibility of security to maintain national stability. I said before and I say it now, the two are not self-serving, they are complementary. We are also enjoined to do this firmly, effectively, but also professionally. We take lessons, of course, from every day of our work in order to improve and do this better. Security officials are well-meaning people. Do not demonize them. Do not demonize them. Rather, cooperate with them in order for them to do their work effectively and seamlessly. The actions of security in the conduct of their work, of course, are guided by the rules of engagement, the SOPs, and those are the checklists in terms of them accounting for what they do badly. The actions of some members of the public accosting security officers are unacceptable, are inexcusable, and cannot be tolerated, whether here or even in the developed world. The principle of proportionality has been expounded on. It's key in the rules of engagement and in the employment of force. What we shall do is also to see that these rules are disseminated to the rank and file so that we do our work and do it better. The IGP, before he stepped out, said investigations were sanctioned into the fatalities of the riots, and where findings indicate particular breaches of the rules of engagement, appropriate action will be taken. The media, and I'm glad we are with the media here, very important players, even more important than before in this electoral exercise, which is peculiar. You should discharge your duty to inform responsibly. Unfortunately, what is visible this far is incitement, is inflammation, not information, especially for the social media people, but also we see it a lot in traditional media. That is what I can say for now, by way of clarifying the points you wanted me to raise.
Thank you very much, General Muhoozi. Now we'll get into a short break, a 2-minute break, and when we come back, we'll be responding to some of the questions that have been sent in on the different social media platforms, but also our panelists will be wrapping up this discussion.
NBS happening now. It's the festive season and the best holidays are where the heart is at the Mistille. We have a gift for all of you. We are offering special offers on our executive rooms, suites and penthouse rooms, rolling from the 24th to the 31st of December. It's the season to be jolly, so come over to Mistille Hotel because all we want for Christmas is you.
Double data. Airtel introduces double data. The biggest deal ever on smartphones in Uganda. Buy a smartphone, 3G or 4G, and get 100% data bonus from Airtel. Airtel is giving you 100% bonus data on all weekly and monthly bundles for every new smartphone connected to Airtel for the first 3 months. Dial *175*9# to enjoy double data. Double data, double data. Oh. Airtel, the smartphone network, regulated by Uganda Communication.
Junior jelly and Baby Junior soap. Soon after bathing them, with no minute, their siblings have already handed me the jelly to spare their toddlers. It has an amazing scent, it smoothens their skins, it prevents diaper rash, and it is good on dry and sensitive skin.
It's a Movit product.
Do your gums hurt? Yeah. Does your toothpaste contain sage, eucalyptus, myrrh, chamomile? All that in one toothpaste? Yes, try Colgate Herbal. Colgate Herbal contains nature's best herbs and Colgate's fluoride technology to give you strong teeth and healthy gums. Ah, Colgate Herbal. Let's go. Colgate Herbal for strong teeth and healthy gums naturally.
NCBA.
Available with up to 90% financing with Ford Finance, supported by Stanbic Bank. For inquiries, visit the Cooper Motor Corporation in Nakawa or call 0313 300 700 or 0705 555 601.
Please make those payments and take dinner out the freezer. Enjoy your day off.
How was your day?
Great.
Did you pay the bills?
Abby did it.
And the plumber?
Abby did it.
Send money to your mom?
Abby did it.
Who's Abby?
Abby.
Bank on WhatsApp with Abby, your 24/7 digital personal banker. That's Africanacity. That's ABSA.
Did you take dinner out the freezer?
Ho, ho, ho! Global Paints ejaguza naawe sekukulu y'omwaka guno. Gwe n'ab'omu makago musobola okuzza enju obujja tosemba. Funa Global Paints mu bika bino: weather coat, silk emulsion, texture paste, super gloss ne undercoat. Gifune kati mu hardware zonna mu ggwanga. Global Paints ekwagaliza sekukulu ennungi n'omwaka omujja.
To be successful, it is vital that you fully prepare for the challenges ahead. Start by conducting a self-assessment to evaluate where you are now and to think through some of the work you'll have to do to get the support you need to organize a successful campaign. Brought to you by
NBS happening now.
You're watching a very special security briefing in which we do have all heads of institutions that wear our uniform with pride. I'm talking about the various shades of that uniform with the black, yellow, red, and the crested crane. Those who protect us when we are asleep and protect our borders from all manner of threats. We do have the Chief of Defense Forces here. We do have the IGP Incarnate in the person of the Director Operations. We do have the head of the institution that protects us from external threats. We do have the head of the institution. I used to learn of it as the University of Understanding, and we've been told that they are doing very well, fourth in the world as far as repeat offenders are concerned. Only 20% of those who come out of that institution ever come back. We also do have doctors here who've been briefing us on the statistics, and we are across all various media platforms, and I've also been handed a copy of the SOPs of the rules of engagement, and you do know that I will make those available on social media and all our platforms. We're talking about Next Media Services and the mighty NBS Television, the Political Command Center. Let's go back to questions, and we will ask Dr. Chobe. It will be Afande Dr. Chobe. Are there cases of reinfection in Uganda? Some have the presumption that once you have COVID and you're lucky to be healed, that's it.
Thank you so much. Yes, we've recorded a few cases, but it's not something that we've systematically been looking out for. We've recorded cases of, would I call it reinfection, possible infection, or potential recrudescence. As you know, sometimes viruses hide in some immune sanctuaries and later they resurface. So we've seen some cases of patients who subsequently were healed, but subsequently were tested positive. What we've not seen yet is whether this is associated with severe illness or whether they are protected from severe illness. So to answer the question, yes, we have seen cases of patients who previously tested negative, but later subsequently testing positive. What we can't discern now is whether it is a new exposure or it was a reactivation of the virus hiding somewhere in the body. As we know, many diseases, many viruses have those tendencies of hiding some immune sanctuaries, which are many in the body. Some of them are in the brain system, some of them are in the liver system, and that system, the semen system, because of the physiology. So where they kind of hide from the protective mechanisms that fight diseases in humans.
Finally, Dr. Chobe, you would probably want to squeeze in one or two comments as way of your wrap-up.
Yes, I've said a lot of bad things, but I would like to say at least a few good things. Is that one is that if we protect ourselves, we'll be able to pull through. Till when? My colleague spoke about the vaccine. My excitement is not on the vaccine, I must say this. Because as she said, the vaccine may not find you. And even when it finds you, you may be actually already battered. But we have an opportunity to be able to protect ourselves. Let's feed well, if we can. And the remedies that we have is basically to build our immunities. And how do we do this? Those who can afford, let's have vitamin supplements, but I know to many it is a bit costly. Eat oranges, mangoes, pineapples, be in sunshine, because vitamin D is shown to have, or deficiency of vitamin D is shown to have poor clinical outcomes, or people being susceptible to severe illness. Exercise, jog in the right way. You can jog at home, we've seen this. Work out and be healthy. Of course, be careful with the lots of social media information, which is most of which could be deceptive, more especially on some therapeutics, which again I would not go into at all here. As I said, the key messages to me is protect yourself, but keep healthy and doing other things.
Okay.
But I also like to say that it's a responsibility of each and every one of us But most likely, I would like to give it to the community leaders, the church, the mosque, and they have done a good job so far to be able to let our people know. And of course, the conduct in the churches since the opening of churches a few months ago has been good. But also, I would like to extend to the LOC leaders, those who live very close to the communities, that if you see people in your village not wearing masks, please remind them.
Okay.
Remind them to wear masks. And if you do see all these activities that congregate people, try to discourage them. Because the idea about the LOCs or our leaders in the villages where we come from is that they know each and everyone in the village. They know the weaknesses of their people, and the dynamics, the social dynamics, the intricate social dynamics in those particular communities, to be able to protect the people. So here the message is that we keep healthy. And then lastly, if you allow me, sir, is...
in a few seconds.
Yes, it will be in a minute, sir. As I spoke at the beginning, that we have sustained community transmission. In the science of disease transmission, that is not a very good sign. And the only interruption or intervention to this transmission does not lie with government, does not lie with anyone, but lies with the individual. So here we need to really be able to protect those who are very vulnerable, the elderly, people who have comorbidities, and also to understand the interplay, the intricate interplay of non-communicable diseases. That is those that we know, really. But of course, even other diseases, knowing that we have a big proportion of HIV patients in this country who are on treatment. That COVID amplifies the pathological, can I say, the effects of these diseases. But also COVID can initiate this. So the issue here, which I would like us to really be onto, is that protect yourself, but the moment you think you've been exposed or you do have the symptoms, which I would like here to repeat, the initial symptoms, that is cough, flu, loss of taste, loss of smell, difficulty in breathing. By the way, some patients will present late when they have difficulty in breathing. And most importantly, the oxygen saturation in the body should be at 100%. Normal. I think we do, all of us. But COVID, unlike other diseases that we know, the oxygen saturation will drop so fast to severe levels when you actually don't know. And to the extent that when we get to know that the oxygen saturation has dropped, it may be too late for us to really come in. And that's why we come in with the issue of oxygen and the expensive oxygen. And then also to be able to make sure that we don't get there. So I would like to request that let's not overwhelm the system. When we have too many patients, then the system will be overwhelmed. Your health workers who are doing a great, great job to save us, to save many, and have saved many, may not have a room of maneuver to be able to save you when we are too many. Thank you.
Dr. Chobe, thank you very much. We will have some social media questions that we will run on the screen, go through all of them, so that in your wrap-ups, the various questions that are specific to your docket will be included there. Tom Simpsons, what is the army doing at roadblock, looking over just ordinary unarmed civilians? What is the army there? And then Oga Gift Uganda. So why did you guys organize the elections when you knew COVID was there. There's one there, Williams Mulindwa. But this loss of innocent lives can be prevented. It is very absurd that Uganda police, when you expect them to act professionally, they act otherwise. And then the government pledged to supply masks to all Ugandans, and this seemed not to have happened. Many people in far-off places in this country have no masks, and they cannot afford a single one. What does this mean? Is the government still in charge of the pandemic fight? Why do we see forces fighting innocent Ugandans who have no access to masks? That came from Snapchat. And then Nicholas Mwesigwa, editor of Trumpet News. Question goes to IGP Ochom. The president has consistently said some elements in the police are working closely with opposition/foreigners to destabilize Uganda, which explains how police has been brutalizing Bobi Wine to tarnish Uganda's image intentionally. So how does police feel serving a leader who distrusts them? And is it true there are weavers in the system? How is police dealing with this situation? I think you can squeeze those in your conclusion. Doc, let me come to you because we want to finish with the doctors, then finish with the gentleman in security. A very key social media influencer has, now that Dr. Chobe spoke about diet, has been advising people to use the 5-hand leaf in tea as one of the things that helps in the prevention of COVID-19. I'm talking about marijuana. You know the science. Is he wrong in your conclusion?
We have not got evidence yet that the 5-arm leaf does work. The evidence that we have at hand is taking vitamins, and if that can be able to be protective. And when we talk of vitamins, to bring it down to the local people, I would say anything colored, any colored fruit is good for you. So that is what I can say, but we haven't yet got evidence about the 5-colored leaf. But just to close, it is 9 months down the road. Living with COVID means that we need to make sacrifices, and each time we make sacrifices, or government makes sacrifices on your behalf, or the medical people make sacrifices on your behalf, you may think you're being picked upon. You may think that you're giving more than you should actually do, but in the end, we are doing it for a common good. And I would leave this is that let's have the patience of a mother, let's have the strength of a father, and then we'll get the joy of a child. Thank you very much.
Thank you very much. Dr. Msenero, you're next on the filing line. Your conclusion and some responses to some of the questions you had.
Thank you very much. I think in my conclusions and in the process, I'll answer some of the questions. One of the issues I must state and let Ugandans appreciate is that up to this point, Ugandans are receiving free care for COVID. It's by choice, you can go to private facility, but the government facilities now, this is unique to Uganda. In many countries, they don't do that. You actually have to pay for your COVID test, your COVID treatment. But it is really, really expensive, very, very expensive to maintain and keep a COVID patient in the hospital for all that long. So I want to thank the government for doing that. It makes treatment accessible to everybody, and also the misunderstanding that everybody must pay for the test. When you are an alert, you are sick, that test is given free. It is when you are traveling or you have chosen to just test yourself or what, then you have to pay. But government is still providing these tests for people who are sick. And we really need to appreciate. It is a pity. Actually, government has distributed masks in most districts. But as you know, this mask was a starter kit. I think because of the capacity of production, it has been slow, but most districts, maybe Kanochov has finished his concluding remarks, but the majority of the districts have received these masks. But if this mask was meant to be a starter to help people, but everybody really in this country could afford to have some kind of mask. You can take just a piece of cloth that you have, fold it, and put some strings, and you can protect yourself, and it is as protective, so long as it covers your mouth and your nose. So yes, people could get the sophisticated ones, but let's take this as personal. The masks may be coming to those districts which are still left, they haven't received, because we didn't have capacity in the country to produce these masks. So when we started, it was slow. Then at some point, we had to give them to school children who are going back to school. So producing and accumulating the amounts as of today, I was talking to the Director General, they are still accumulating some to do the final distributions. But my fellow Ugandan, take care of your life. The easiest thing, one of the easiest things we can do is to keep away from crowds, because that one you don't need any money. Keep away from your gatherings. Let's take COVID control as personal. It's easy to be excited because there is a meeting, because there is this, but usually when people are in intensive care, they are alone. Or when you're burying your loved one, because a young person went to some meeting, was excited, and then you came back and infected your mother and infected your father, and by the time we are through with the COVID, you are not there. So I would like to encourage all of us to take this COVID as personal. I want also to end with saying, hope is coming. Hope is there. It is not like when we started, when we didn't understand the disease. Now we know that treatments are coming, vaccines are coming. If you can keep yourself safe now until that comes, and this is possible, it is within our reach. Make that decision for yourself, make that decision for your brother, for your mother, for your friend. And if we all work together, we call it public health, because we all must do something to ensure the safety and health of all. Thank you so much.
Thank you, Doctor.
I don't know if you wanted me to comment on the elections, why we decided. We were part of the scientific team, but Ugandans had worked with us so well. And we thought that this was it's a democratic process that citizens deserve to select their leaders. And at that time, we were all working together. But it was that change in compliance, that change when certain people didn't either know how to handle politics this way. The agreement the scientists had with the Electoral Commission is that candidates will all, and the Electoral Commission called all the candidates of all political parties, all the leaders, and they all agreed to keep these SOPs. Actually, they convinced us that they are going to be able to keep the SOPs. So we look very alarmed when we see that after that, those agreements, then there are people who don't care. But all of them, all politicians, the best thing you can do for the people whom you are aspiring to lead is to help them stay alive. Whether you are an LOC3 councillor candidate, you are LOC5, you are an MP. I know we are talking a lot about presidential candidates, but many of you know what you're doing there. You are holding meetings, you are causing people to be infected. Protect the people whom you are asking for votes, because if they die, whom are you going to lead? Thank you.
Thank you very much, Doctor. We'll hear the parting shots of Ambassador Muchwet.
Thank you, Sila. Under the Security Organization Act of 1987 of the Republic of Uganda, intelligence agencies are constitutionally mandated to collect, to receive, and process intelligence, and this leads to detection, curtailing, and prevention of threats against Uganda. In this regard, and because of the dynamic nature of the threats, intelligence has been able to respond to the threats as they emerge. We cannot say we can deal with all the threats conclusively because all the time different threats emerge, but we always respond, and very professionally. And we have fulfilled always our mandates to date, of course in collaboration with other actors within the defense and security sector. We are calling upon the population especially, because when some cases arise, people tend to think the whole, say, city in Kampala or the whole country is seriously affected. But as we know, and from intelligence, usually it's a minority of people who cause problems for the majority, who are law-abiding, who are doing the normal things. So we call upon the few to be what we'd call sensible. Most of them are misguided. Most of them would have been innocent people, but because of some political leaders who have ulterior motives, they misguide, they mislead some young people into doing what they would otherwise not have done. And in the end, it causes problems, and usually for them. So we call upon the millions of law-abiding people. We have lots of oppositions who do not believe in such acts of violence. We have so many people who condemn it. So we call upon you to help us, security, in leading those who have been led astray. As I had mentioned earlier, for us in intelligence, we always use intelligence-led operations, but we need politicians, and they are doing it, and we applaud them to talk to the people, including opposition. There are many who discourage the negative elements from doing negative acts. Otherwise, as intelligence, we are professional, we are very proactive, unlike what Samson tried to suggest. We are very, very proactive. But at the same time, we have to restrain power. So even when we know something going wrong, we try to restrain power until it reaches a certain level. Intelligence agencies remain focused in our mandates, as we have displayed